It's been over a year now since former Jimmy Carter entered hospice care. We usually think of people entering hospice when they only have days or weeks left to live. Now experts are hoping the former president's story will raise awareness and inspire others in similar circumstances to enter hospice care sooner. And joining us now, Jonathan Fleece. He is the president and CEO of Empath Health Tidewell Hospice. Welcome, Jonathan. We're so happy to have you here.
Thank you, Linda. It's a pleasure to be with you this morning.
Now, maybe it's just me because hospice has been wonderful to my family. And I was surprised, Empath and Health and Tidewell Hospice. What's the connection between the two?
So the hospice benefit has been in America since the early 80s, created by both President Reagan and actually President Jimmy Carter was a big part of creating the hospice benefit. In the early years, most of hospice was not-for-profit. Over the last 40 years, 70% today of hospice is for-profit. Tidewell has been a legacy not-for-profit hospice organization in our community for 44 years, now supported by the Tidewell Foundation. Not-for-profit hospices across Florida want to preserve that mission. So we will soon be 7 hospices, Tidewell Hospice being one not-for-profit, across Florida that have all sort of come together under the Empath Health brand so that we can continue to provide extraordinary full-life, end-of-life care as not-for-profit under the Empath Health organization.
Oh, that's great. And President Jimmy Carter has been in hospice care now for over a year. What's the length that you expect somebody to stay? We always thought it was either days or weeks.
That is a common misperception. The average length of stay in hospice is 70 to 80 days on a national basis. And what we find all too often is that patients and families, when they do enter into Tidewell Hospice's care, hospice care, is they say, we only wish that we had known how wonderful and amazing hospice care can be sooner. So we love to have these conversations to educate the community about considering hospice earlier in end-of-life care journey.
What's the difference in the care you get in hospice and in traditional health care?
So in traditional health care, the primary goal is cure, treatment, and rehabilitation. At some point, for all of us, regardless what that continuum and time frame looks like, we know that we will all face end of life. So when patients and families find that it's time for them to embrace end of life, the shift when patients and families enter into hospice is really more around comfort. It's more around meeting the patients where they are. We every day will ask our patient, what's important to you today? Sometimes it's medical, sometimes it's much broader and more personal. They may want to have a trip to see a sunset. They may want to make a video or an art collection for their families to keep as a keepsake. They may have a lot of unresolved issues, whether those are within family or within themselves, estate planning. So we shift from the poking and the prodding and just what can be a chaotic world of healthcare to calm and to peace and to comfort, to really help people get ready for end of life.
Well, you were wonderful at keeping my husband pain-free and very alert and aware right up until the last minute. And of course, the workers are trained differently, aren't they?
They are. So end-of-life care is a very special time for patients, for families, and it is critical that we as an organization provide extraordinary care. Unfortunately, our traditional nurse education program, this is both in Florida and nationally, the programs don't really have focused hospice care training. So Tidewell Hospice, thanks to the support of the Tidewell Foundation, we are the first national program to have an accredited nurse residency program by the American Nurse Credentialing Center, and we are just thrilled now to be able to hire nurses right out of nursing school, put them through our nurse residency program and really teach them the special care that we provide at Tidewell Hospice and what we call full life care and interdisciplinary care, which is just very unique.
That's wonderful, and thank you so much for the care that my family has received from hospice over the years.
Oh,
you have made a wonderful difference.
It's always a blessing and honor to serve.
And you can learn more about Empath Health by going to empathhealth.com. It'll tell you all about Tidewell Hospice, too. And coming up, our ABC7 movie experts get us ready for the Oscars.